Welcome everybody to the break. Today we're discussing safely returning to normal operations for COVID-19. Previously on the break, we have discussed the government plan for reopening, the phased reopen, identifying different businesses that will reopen and what time structure they're going to be doing so. This, the break, which Clare will be instructing, will focus on the more micro of what businesses themselves need to be doing. So rearranging the chairs or having protective equipment and things like that that Claire's going to dig into. So with that, I will turn it over to Clare to get us going.
Hi everyone, and thanks for joining us to learn how your office can return to safely returning to normal, as much as normal will be for the next foreseeable future. So with that, we'll just start by just discussing how you can assess your risk levels, touch on the OSHA guidelines from the federal government, and then kind of go into the exact details of how you can actually implement the OSHA guidelines within your office using guidance primarily from the state of Connecticut. So the first step for all of this is to develop an infectious disease plan. You probably already have one that you either already had or threw together in February, back when it was starting to become clear that COVID-19 might actually impact our region. So we know it did. And that should just be a living document that should continue to be updated regularly, particularly now that we're looking at reopening or expanding your office operations. Some of the key considerations for developing your plan should be including where and how workers might be exposed to COVID-19, particularly their contact with the general public, customers, and other coworkers. Take non-occupational risk factors also into consideration. Each community is different, and COVID, part of why everything's had to shut down is because of community spread. So how the risk factors of a community somewhere such as the West Village of Manhattan are going to be very different than Glastonbury, Connecticut. And it also depends on if there's an outbreak in your community or not. So just take those factors into consideration, as well as the individual risk factors, particularly employees who might be at high risk of infection or live with someone who's at high risk of infection. And once you kind of have considered all the different risks to your community, you can develop controls to try and reduce and manage the risks. And throughout this whole process, it's important to consult frequently with the federal, state, local, tribal, and territorial recommendations and requirements. And those are being updated regularly and will also help answer questions about the risks to your community and what people who are at risk or live with someone who's at risk should also be taken into consideration. So we talk about risk level, and OSHA, the Occupational Safety and Health Administration, created this pyramid. It's in their book linked below to determine, that kind of illustrates that businesses are medium or lower risk. So low risk exposure risk is where it's people who may have minimal exposure to the general public, minimal exposure to even people in their office. So chances are insurance agencies are in the lower risk at the bottom of the pyramid. And medium risk are people who require frequent or close contact with people who may but are not known to have COVID-19, especially in areas where there's community spread. So this would probably be more of your grocery store workers, or if you work you have an agency that depends a lot on walk-in business or people walking into your agency to pay their premiums. The people in your office who interact with members of the general public regularly would probably fall into the medium exposure. In all likelihood, you are not high or very high, because those are almost all healthcare related, either directly or indirectly, working with people who have tested positive or have likely tested positive for COVID-19. So if you're just interacting with the general public, it's medium risk. And that matters when looking at how to manage the risk within your office. OSHA lays out in 4 different levels of control, from the best to the least effective. So the most effective are engineering controls, then which are the controls that don't actually rely on workplace behavior. They're systemic they're changes within the building and construction. Then there's administrative controls, which are the changes in work policy. safe work practices, which are the actual practices to reduce the duration, frequency, or intensity of COVID-19 exposure. And then lastly is personal protective equipment, which should definitely not take the place of other prevention strategies, but is still important to keep in mind, particularly in situations where people have no option except to work in close proximity and can't always adhere to social distancing. So all engineering controls are both the most effective ways to reduce the spread of COVID-19, but are also the most costly and complex. As a result, they're not really required for low-risk workplaces. You can always consider them, but they are not required. Medium risk work sites should consider physical barriers where appropriate. That's why grocery stores have all erected those plastic sneeze guards to try and reduce the risks to their workers. Those are the types of the lower cost options that might offer physical barriers but aren't requiring like a systemic change to your construction. A lot of these primarily apply to places like hospitals where people are at very high risk, or at least high risk. Administrative controls are changes within the workplace policies. So medium risk workplaces should consider minimizing contact among workers, clients, and customers to the extent possible. And all workplaces must provide workers with up-to-date information and education to ensure safety. So the rest of a lot of these are just straightforward. It's encouraging workers to stay home when sick, minimizing, establishing alternate schedules or staggered shifts to reduce the number of workers in the facility at a given time, having an emergency communication plan if you don't have that already, and making sure all workers are trained who need protective equipment. So if workers can't always adhere to social distancing, make sure that they know what equipment they should be, personal protective equipment they should be using. And that leads straight into safe work practices, which are providing the resources and work environment that promotes personal hygiene. That includes requiring regular hand washing or the use of alcohol-based rubs, and posting hand washing signs in restrooms. Just come every restaurant that you've been to that you wish you could go to this week, and have all employees must wash hands, because that's a good way to remind people. And then lastly, there's the personal protective equipment, which is one of those phrases I did not know. I had never entered my thought process until a couple months ago. Now I say constantly. It's not going anywhere. Employers are required to ensure that workers have access to cloth face masks. Medium risk employers should consider face masks for employees, especially those interacting with customers. The low risk workplaces are not required to require them by OSHA, but states are different. And a lot of the face mask requirements that have required all of us to go find them online and potentially buy them from in our favorite sports teams or characters are because of state requirements. So Connecticut has already made it clear that they're going to require face masks in common areas and when entering or leaving the workplace. It's likely that the other states will follow, and we'll get to that further in the presentation. But for the foreseeable future, customers must also wear face masks when entering a facility. So make sure to bring it to the grocery store, and that's not going to go away immediately with the reopening. The big difference for businesses is that they are required to provide face masks for their employees to adhere to their requirements to provide a safe workplace. They're not required to provide a face mask to customers, so that you can turn away a customer who doesn't have a face mask. That's not stopping you from providing them face masks. It's just you're not required to. And so some additional considerations are to actively encourage sick employees to stay home and encourage sick leave policies that are flexible and consistent with federal and state requirements. A key thing to remember here is that the federal emergency sick leave extends through the end of December. So for the next couple months, you can really emphasize that if an employee has a cough or demonstrates other COVID-19 symptoms, they don't need a doctor's note to take sick leave, and we'll hit on that later as well. Dropping any requirements for healthcare provider notes for sick leave, maintaining a flexible work policy that allow employees to stay home to care for sick relatives, so that if they are potentially exposed at home, they're not then passing it along to people in the workplace without demonstrating symptoms. And just kind of be be aware of employees' concerns about pay, leave, safety, health, and other issues that may, particularly because that may impact their behavior and put people in your office at risk if they're very concerned about some issue such as having to pick between going to work and earning an income. So being able to highlight that for them can also help keep your workplace safer, and everyone, something that hopefully everyone wants. And make sure to distribute information from insurance companies and public health agencies about medical care. Chances are, if you're an employer who's providing health care from your health insurance, you're getting information from the health insurance provider that you can then distribute to everyone in your office who at least is getting employer-sponsored health insurance. Even if they're not, it's useful information to have. So keep that in mind when you get those emails. So those were kind of broader, and we're going to go in more depth for the new office space. So this graphic kind of illustrates what we're about to talk about in an actual visual form. It's from the Connecticut Guide to Reopen Connecticut, so you can look at it closer. But the key is for all the, so while we're specifically going to be talking about what Connecticut's recommended, but in all likelihood, this is very similar, if not going to be almost the same as what New York and New Jersey will recommend. They just haven't issued their guidance for offices to reopen yet due to kind of differences in each state's reopening policies. So Connecticut allowed offices to reopen at 50% capacity on May 20th. No region of New York or New Jersey has yet to hit that phase. So that's why we're going with Connecticut, but it's a good way for all states to prepare. The first step for Connecticut's reopening guide for offices is the process of planning the reopening. So the first is to continue to encourage workers to continue to work from home where possible. Chances are most of your employees have never wanted to go into their office more than they do at the moment. But this way, kind of instead of everyone coming in the same day, having staggered shifts or continue at least some working from home to minimize the people in the office is still encouraged. To plan for the reopening by appointing a program administrator, someone who can make sure that the bathrooms are clean. All of this is being implemented. Just kind of your point person where you can ask them, where you can hand them the guide and they will be responsible for ensuring that it's actually adhered to. Just things, continue with the work from home, stagger shifts, stagger start-stop times. So not everyone's racing into your office at 8:25 to start at 8:30, spreading it out so that people are kind of not all trying to go up the stairs at the same time. And same with breaks for stuff like lunch breaks, so not everyone is trying to use the microwave at the same time. Maintain a log of employees on premise at all times. This is key for contact tracing as well. Stay tuned for later in this video. Limit visitors and service providers on site. Train employees on the new rules and protocols. Procure all necessary PPEs. So if you're in New York or New Jersey and you're preparing to bring at least part of your office back, making sure everyone has face masks. They can provide their own, but it's also your duty as the employer to have the cloth face mask ready for them. Develop and distribute cleaning checklists. Complete a thorough cleaning prior to reopening to make sure everything's clean before employees return to work. And for Connecticut specifically, there's a self-certification on the Department of Economic and Community Development website. That also provides you a virtual badge that you can post on social media and your website to share with customers and the general public that you have taken the steps required to recommended by DECD to reopen. So that way, if you're starting to open your doors up to customers again, they know you've taken these steps and are continuing to take these steps to reduce the risk of COVID-19 spreading as much as possible. When it comes to the physical space within your office, one key is to post clear signage enforcing all the new policies. That includes social distancing protocols, cleaning and disinfectant protocols, PPE protocols, and emphasizing that employees should stay home if sick and all their available sick leave options, including the state mandated sick leave and federal emergency sick leave. While this isn't a complete engineering change, another thing to consider are ventilation changes. So increasing the rate and increasing the percentage of outdoor air that circulates when possible. So I didn't know comically little about ventilation or air circulation, having a window air conditioner literally sitting behind me. But this is something that you don't have to install it or go find it, but just check to see if those are options to reduce the amount of air being recycled throughout the day. So that way it's not the same air being constantly recycled. You're kind of bringing in air from outside to mix it up. Also enforce social distancing by having visual aids and visual social distancing markers, especially in places like lobbies and your elevators. So this is just pull out some tape and measure a 6 foot distance from the elevator to try and make it very clear to people what the amount of space. It's not, get that tape measure out as well, figure out what 6 feet is. Depending on how your office is arranged, just consider rearrangement as necessary to ensure everyone is at least 6 feet apart from each other, and also staggering the desks so employees aren't sitting directly opposite one another. And social distancing cannot be maintained, put up partitions to just as a physical barrier. And also consider implementing discrete work zones, which are whenever possible, segmenting work areas to reduce the movement between zones. So this would be, for an example, if you have multiple floors in your office, requiring employees to effectively stay on their floor, or limiting how much they can leave their floor as much as feasible. So if everything an employee needs in the workday is on, let's say, the 2nd floor, effectively prohibiting them from going up to the 3rd floor or down to another floor. Similarly, if you have different office suites and everything an employee needs is in their office suite, saying, okay, when you're at work, you can't really go places. So just that way, employees aren't, if someone does contract COVID-19, it's reducing how many people they're exposing within the office. Also, trying to reduce the sharing of equipment and then cleaning where that's not possible. So just everyone has their own computer, not allowing people to kind of go between computers as much as necessary. There are situations such as printers where that's not feasible. You can't get everyone their own printer, but have it cleaned as much as cleaned after use. Close non-essential amenities. The example of this is coat rooms in Connecticut, so that shouldn't be an issue at the moment due to the fact it's summer. Install touchless appliances where possible, such as soap dispensers, and the hand sanitizer at the entry. And another specifically Connecticut requirement is to post a hotline for employees to notify the state to report violations to the state rules. So effectively saying you need to, employees are the ones enforcing this if you don't take it seriously. And for Connecticut, that hotline is 211. So in Connecticut, but likely this is something I expect will come up in New York and New Jersey as well. Employees are required to wear face coverings unless doing so would be contrary to his or her health or safety. Key is discomfort is not a health or safety reason. Just not liking a face mask is not a reason to get out of wearing one. They're required where social distancing isn't feasible, but not required in segregated spaces. So this means if you've rearranged your office to ensure that workers are at least 6 feet apart, they're not directly across from each other and all that, employees won't have to wear face coverings when sitting at their desk doing their job. They would only need to wear them when moving around the facility and also when arriving and leaving work. Employees may bring their own cloth face covering, but employers must ensure each person has one. So one of your employees has just gone crazy and bought a year's worth of Buffalo Bills face coverings. They can wear them. You just also have to make sure they have another option or not required to go buy them themselves. So when it comes to cleaning and disinfectant, hand sanitizer should be available at all entrances and in common space. You should also promote hand washing, specifically the 20-second hand washing with soap and water. There's a lot of funny videos to really help promote this that might demonstrate it better than I can. And again, be inspired by restaurants and their signs in bathrooms and reminding everyone to wash their hands. Now, I assume everyone in your office is an adult, but they're in restaurants for a reason. a fairly easy way to remind people to wash their hands for 20 seconds before returning to their desk. It's also important to clean and disinfect bathrooms frequently. Log the cleanings and clean multiple times a day and hourly if necessary. This is something you can kind of figure out based on your office and how many people are there, what you need to do. It's just important to keep in mind that you are responsible for keeping it clean. You can also make cleaning disinfectant products and or disposable disinfectant wipes available near commonly used surfaces. You should follow the CDC and EPA guidelines for cleaning products that are both effective and also safe. This also will, you can also make it, recommend that employees use it to clean their own space, just so it doesn't save you from being required to make sure that their workplace is disinfectant and clean, but also allows them to kind of do it themselves just for extra comfort. Because I know this is probably on everyone's minds at the moment. And then just returning to one of the key points is making sure employees know not to come to the office if they're experiencing any COVID-19 symptoms. And so those would be coughing, a shortness of breath, and or two of the following symptoms, which are fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste and or smell. And emphasize not just the importance of staying home, but also the federal and state sick leave options they have that will allow them ensure that they will still earn their income, they will get paid leave for taking this time out. So they're not going to have to pick between their paycheck and coming in and health. It's better for everyone if they have a cough, they stay home. And one of the big keys going forward is going to be the tracking of COVID-19. New York has really emphasized the expansion of contact tracing to allow regions to reopen. And within the workplace, this is important. This is why you have to keep a log of everyone going in and out of your office so that you know effectively who's coming into contact with who and can give it to the public health departments fairly quickly. So if an employee in your office does test positive, they should notify you immediately, and you should follow the state testing and tracing protocols to try and minimize the spread. So many of these required and recommended protocols are really intended to reduce the risk of exposure to others. So it's, as much as we want to try not to get COVID-19, a lot of these are to try and minimize the spread if it does get into the office by promoting social distancing, promoting cleaning, kind of promoting the bubbles within the workplace of minimizing who's coming into contact with who. But for the most part, it's things that don't require a heavy investment from your agency, just kind of planning before workers start returning to your office. So that being said, if you have further questions, please let myself, Brad, or the PI Resource Center know. Below the video are links to the OSHA guidance, the Connecticut specific protocols for rules for offices that are really useful even if you don't live or work in Connecticut, and links to New York and New Jersey websites where I presume the further information will be posted when phase 2 starts to hit for New York and New Jersey. And PI will be sending further information out as those become available.
Awesome. Thank you, Claire. So I have a couple comments or questions if you have time here. One I wanted to bring up is you mentioned personal protective equipment, PPE. You said nobody thought they were going to have to become familiar with PPE entering their vernacular, but now everybody has, right? Yeah. And one thing you said was very interesting, a point that's worth reiterating, is that it's a bit of PPE is a supplement, not a solution in itself. And that's particularly true. Another class that PI put on a couple weeks ago was COVID in the construction site, taught by attorney John Trifredanos, and he brought up the idea that you can't sacrifice other safety requirements in the face of COVID. So he was specifically talking about construction sites and perhaps a 2-person lift. If something's a 2-person lift, it's a 2-person lift. Just because somebody needs to get closer than 6 feet doesn't mean you can now make it a 1-person lift. In those cases, that's when PPE should come in to help protect those employees. That's the appropriate use of PPE, not to solve the issue of and of itself, but to provide workers with a safe environment while perhaps practicing something unsafe social distancing by necessity.
Yes, and the other thing with the PPE is that based on what I've read about it, is it's really preventing you from spreading it to other people. It's not going to prevent you from catching it. It just means if I'm sick with something and I'm wearing the face mask, the likelihood of everyone else around me getting it decreases.
Right.
That's all. It really is just reducing the risk. It's not taking it away. And along the same lines of, it's why it's really important for wearing the PPE also when employees, you can't really control who else is going to be on staircases or who's going to be going in and out of your office at the same time. So that's why it's key for when people are kind of moving around the building, but not necessarily at their desks.
Right. You can set your office up in the best way possible. There's still people are going to interact and run into each other, so it's inevitable. One other thing I want to mention that a lot of insurance agencies don't want to hear is the point you made about workers working from home if they can. And that seems to be the guidance that's coming out from a lot of state governments, is that throughout this reopening process, there's still a strong, I don't want to say order, but at least a strong encouragement from governments to say, if you have employees that can work from home, make sure they're doing so. And that's particularly true of the kind of the sedentary office environment. A person who's sitting at their desk on a computer can sit at their desk on a computer from home is the reasoning, or the logic, I guess. So yeah, I think you're going to see a lot of those businesses maybe not get employees back in the office quickly because government is saying, well, if these people can work from home, it's safer, and they should be. So there might be a delay in getting some of these office workers back in. Yeah.
Well, that also goes to when thinking about your reopening process, what individual risk factors there are for employees. Because if employees are still are in high risk category, they're still going to be at risk in the next couple of months. So making sure to have that as a consideration and address each individual employee's concerns. And there's also the opportunity to have kind of hybrid start allowing employees to come back into work to work at least once or twice a week, or stagger shifts in ways that get them into the office, but also you're not having full capacity. You're at 50%, they're half and half. And also even just recognizing that a good number of employees are still probably also functioning as amateur teachers at the moment. And that's not going to end anytime soon because all summer camps are being canceled. So it's not, there's a lot of things that are still, it's not going to be, we can't just flip a light switch and go back to normal. I don't think normal's, what we used to consider normal is really going to be coming back in the foreseeable future.
A really good point. Anything else to add before we conclude?
I just to say that a lot of these solutions are fairly low to minimal cost. So you can do a lot of the markings with things you've printed off a photocopier with tape on the ground or tape on the walls. So other than procuring hand sanitizer or touchless soap dispensers, and even with those, the requirements for those usually reflect the financial abilities of the office. So if you're not able to immediately get those due to either financial situation or supplier situation, which is probably more likely at this point, it's not immediately mandatory. It's really, those are considerations, and a lot of these solutions are intended to be fairly low cost and things that just are recommended to plan for to reduce the risks, not asking you to take on a huge financial burden to limit the risks.
That's a great point. I think a lot of people might be thinking, wow, this is so expensive, I'm not going to even bother doing anything at all, right? But that's never a good answer. Even if you can't afford certain things, buy a roll of tape at the very least, so that you can demonstrate, where people should be in terms of social distancing. That you would think that most people could probably swing, a roll of duct tape.
Yeah. Roll of tape, some sheets printed out, notifications printed out on paper, and maybe some feng shuiing of desks.
Right, there you go. Something is better than nothing.
Yeah. So it's really within your financial capabilities what level of this you have to do.
That's a great point. So. All right. Well, thank you, Claire. Really appreciate it. I know that our members have been really clamoring for information really specific on how they reopen. So hopefully this will prove useful. As Claire mentioned, if you have any questions, please let us know. And I guess we'll see everybody very soon.